we are here. Chronic Crusaders really went far today. We went all the way to Ann Arbor because Mary has an appointment with our DK. So, anyways, Mary set up an appointment with a very special friend named Susan. And Susan, I understand that you had an amazing therapy called CAR-T, CAR-T. And I know nothing about it, and our viewers might not know anything about it, but maybe you could just tell us what is CAR-T, tell us who you are and where you're from, maybe how long you had scleroderma, just a little introduction here.
Okay, thank you for inviting me to do this.
Our pleasure.
I have had scleroderma for about, trying to count here, about 3.5 years at this point. Spring of 2022 is my diagnosis. It was rapid onset, rapid progression, RNA Pol 3. I was lucky in the sense that I have some lung damage, but it's relatively minor. I'm not considered in a severe organ damage group. I was in a severe skin cohort. I had joint contractions, all that kind of stuff. I also had a lot of pain, joint pain, skin sensations, nerve pain, and you don't hear about that a lot when you're a newly diagnosed patient. You're told about things to look out for, concerns about lungs and kidney and heart and whatever, but nobody says this is an insanely uncomfortable, painful disease, and it really limits your ability to function.
I think that's amazing that the words that came out of your mouth were, I have some lung involvement, but it's like it's not a big deal, but yet, like, when you first read about it, it probably was a giant deal emotionally to you. Do I have organ involvement or not? Just, I'm talking first diagnosis.
Yep. And it actually helped me a little bit for a while. I had some improvement, and I credit it with putting me in the right place to be eligible and ready for CAR-T.
Sure.
After the benefits wore off from the Bravos trial and I was progressing again, we started looking at more possible trials. We, as a sidebar, picked up on all of the HRCT lung scans that are done that I had what's called an adrenal incidentalloma. So a nodule on one of my adrenal glands, which is actually not terribly unusual in the general population. And over the course of a year, they could see it was growing, and they could not be 100% certain that it was benign. Looking at the imaging,
like one more thing,
adrenal cancer. Let's talk about
which one do you pick?
I know which one I picked. Scleroderma, hands down. But so at the time, they were saying, well, if there's any chance it might be malignant, you want it out as fast as possible. If it's continuing to grow in a couple of years, you're definitely going to want it out. Your lungs are not bad right now, but you're showing a trend towards getting a little worse. You don't want to get to the point where anesthesia is like, so let's just get it out. So, sidetrack.
That was just one just little extra thing. Yeah. And we all have that, right?
Exactly. You got all of regular life.
An accidental nodule shows up on a scan because you're trying to look at your lungs for scleroderma.
Yeah, it's not like your body says, oh, you're dealing with enough with scleroderma. We're not going to do anything else.
Roll that back.
It's more like, okay, let's see how much we can throw on top of this. And by the time I had really recovered from that and it felt comfortable with looking at trials again, there were a few, I think DAISY is still going on. There's a couple of others I don't even remember the name of, but it was CAR-T's coming down the pike.
Susan, why don't you tell us exactly what CAR-T is? I've had scleroderma for 20 years, and I don't even know if I'm eligible for CAR-T. I really don't know what it is, so maybe the Reader's Digest version, like for dummies like me, how about?
CAR-T for dummies.
Yeah, CAR-T for dummies. I like it, Mary. I like it.
CAR-T is a bunch of words, which I'm not even going to say because unless you're a scientist, they don't make sense.
Okay.
Even as a scientist, I can tell you I probably had to do a little research to truly understand it because I'm not an immunologist. My former professors are probably going, she took immunology. Why doesn't she remember this crap? CAR-T is a type of cellular therapy. So in some people or some doctors will describe it as a light version of stem cell transplant. So instead of the case with stem cell where you do heavy radiation, chemo, you wipe out your entire immune system, and then you put back stem cells and ask your immune system to grow back normally and go through a very long time where you have no immune system and you have to be very, very careful. Stem cell, it has proven very beneficial for scleroderma patients, but there is a risk that that the treatment will kill you.
Right. That's when I first got diagnosed. I was like, Dinesh, just get me a stem cell transplant. And he's like, well, the side effect could be death. So probably for you, Sherry, this isn't an option.
And for a small portion of patients, it doesn't work. So
Okay.
to go through that risk
wow.
and have it not work, or have it work for a while and then relapse, that's taken on a lot. That's a huge, huge risk.
Understood.
So CAR T is essentially taking a small subset of your cells. So not your stem cells. You go into what they call apheresis, which is a process where you get hooked up to this big machine. For most of us scleroderma patients, it is a poke in the neck because our veins just simply cannot tolerate what would be the normal lines or a PICC line. So to get the volume of blood they need to put through this machine and get cells in the course of 3 or 4 hours, they go straight into your neck, which is really not that bad.
Great.
I did it without sedation.
Good.
It
right
was
there in the apheresis room, right?
Actually, interventional radiology
did
does
it.
it. These guys are amazing.
Wonderful.
I think a lot of us have had skin biopsies. We know that lovely lidocaine feel, which to me is worse than anything else. That stuff.
That burning, yeah.
That was all it was.
Great.
You get a sting. I told them it usually takes more than one dose, like 1.5 to really numb me. They did that, and after that, all I felt was a little pressure.
Perfect.
Really simple. And they take your blood and they put it through this machine that filters out specific cells that are part of your immune system. In this case, they're looking for what are called T cells, which are a very important part of the cells in your body that help you fight diseases and infections. Once they do that, they take those cells and they ship them off to the sponsor, the company that is doing the trial.
Okay.
That company then takes these cells and engineers them. It uses a inactivated virus to put information into the T cells that's going to tell it when they give you your cells back to go and attack B cells. B cells are another part of your immune system. They are the cells that make the antibodies, the autoantibodies that we have that are inappropriately attacking us. So the whole idea is to get rid of the B cells that are making autoantibodies against us.
Okay.
There have been a number of other drugs out there that have targeted B cells, but they only target them in your blood.
Not your entire body.
Not your entire body.
Oh, so they're hiding out in other places.
They're hiding out in other places. They're in your blood, they're in your bone marrow, they're in your lymph nodes. So the whole idea of CAR T is once the manufacturer puts this stuff into the T cells, it is a way that the T cell, when it comes back in your body, recognizes something on the outside of a B cell. It's called CD19. So it's essentially a marker that allows the T cells to specifically target just the B cells and not destroy a lot else in your body, which is what you go through when you do like radiation for stem cell transplant.
That's why it's more evasive with stem cell than with CAR T.
So, yeah. And when they put it back in, these T cells go into your body, they expand their population, they grow.
Wow.
And they attack your B cells not only in your blood, but they go into your lymph nodes as well. So what we're looking for is what they call deep B cell depletion. Their purpose is to try to get rid of every B cell in your body, if at all possible, and then allow your body to reset itself, your immune system. The trial I'm in, Cabaletta, they're now calling it, I think, Reset or Resell or something like that.
That's what they've named.
They've been naming it.
Okay.
And they've also done this initially. They've done it with lupus and some inflammatory myopathies and things. So they're working through a variety of immune types of diseases.
Sure.
So the idea is you're going to go in, you're going to get rid of all of the B cells that are causing the disease. You're going to give your body months to come back, make brand new baby B cells, which are called naive, meaning they have not been exposed to anything. They don't know, they have not learned or retained the memory that your other B cells had to go after your own body. They're coming in like they're
Brand
completely
new.
fresh and new, and they don't have that little, prejudice in them. So,
Wow.
yeah. And over the course of time, as your immune system comes back, part of what they do is they test you to see how many B cells do you have? Are they coming back? They look to see, are they naive? What do
And
they
you want them to be naive, correct?
And then slowly mature. But as they mature, hopefully not to decide again to start
To
going
attack
after
your own immune system. Correct.
Exactly.
Okay.
One of the things that they do here at U of M is because they want to know if there's deep B cell depletion.
Yes.
It's kind of a tag-along study where they can. So the target when they go in to do a biopsy is very small.
Mm-hmm.
So there can be some discomfort with that. It often involves one person going in with this little probe that's going to go and snap off a piece,
Okay.
and somebody else kind of
Scoops it up. Yeah.
trying to keep it from rolling out of the way, because these could be teeny tiny little
Sure.
things they're going after. So you want to see what it looks like normal before the CAR T, and then you want to look at it a few weeks afterwards, and hopefully what you're going to see is all the B cells are completely gone, which is what we found in my case.
I'm so happy for you. Yeah, we should all be throwing a big party for Susan. I mean, that is the best outcome
Yep.
from my knowledge of, and you did a great job explaining it. Like, I'm picturing these T cells getting all,
I did a lot of teaching in my
all right. Well,
prior career.
you did a great job, because I'm picturing these T cells going in and targeting B cells, because they know if they're looking for the something 19. What is it called?
CD19.
C19. It's like, you're going in to play laser tag, and wherever there's a CD19 blue target, they're going in. Yeah.
It literally attaches.
It makes so much sense.
And by attaching to the B cell, it essentially causes it to explode and die.
Sure. So then that B cell is done.
Done.
A couple of questions. The lymph node can I ask, is this too weird to ask, where was the lymph node that they
For me, they used my groin.
Okay.
They're in my groin. Most of the patients, that's where it's been done.
Okay.
The largest lymph node they found for me was actually in my underarm area.
Yeah.
But I had a lot of joint contractions, and I also have shoulder injuries. So there was no way during the course of an ultrasound guided going in and taking, they try to get 4 samples, that I could have possibly stayed in the position they needed me to do. So we ruled that out.
Sure. I just was curious, like, were you awake for that procedure as well? Yeah.
Yes.
And like you said, there was no pain because they
It's
used...
lidocaine. It's the same as if you've had a biopsy done on your skin.
And most of us have, right?
Yes, yes. There's a little more of a feeling of pressure, because from where they go in, they are pushing in
to get the sample.
and there's somebody else who is pushing, or think of it as like putting little bumpers on either side of
to
this
keep it
lymph
from
node,
rolling.
to keep it from rolling out of the way.
Okay.
Because the surface of the lymph node is kind of dense and difficult for them to get this probe through, so they have to hold it steady or else it's going to roll.
Makes sense.
It's quick, it's easy. Because you've got a lot of large blood vessels in that area, at least here at U of M, the procedure is if they do a biopsy in the groin area, you hang out in recovery for an hour just to make sure nothing's going to bleed, and then you get up and you walk out.
Great.